Let's get into something that we unfortunately had to pass up on last week, and that is What's Up, Doc, where we spend some time with the experts in health at Mercy Health. And this morning, our topic is labor and delivery. In particular, what you could expect when giving birth at Vaughn Bay Hospital, Riverside. Not you or me, but, the women who are listening.
Not me.
No matter what the condition.
No.
Not me.
No twins episode for me.
All right.
No, not twins. Junior?
Junior.
Yes.
Yeah, that was the Oh, man, no.
Poor movie.
I wonder if Ashley's already hung
She's
up.
like, what is going on?
Why did I agree to this?
Why
Why was I forced to do this? I don't want to talk to these guys. We're going to spend some time with Ashley Vaughn, who's an RN and is going to explain what RNC-OB means at the end of it. Ashley, good morning.
Hi, good morning. How are you?
We're good. How are you?
I am wonderful.
Give us all the letters that follow your name.
So RNC means I'm certified in OB. So I took a class to become certified in what I do and what I love. And you have to take a test that's almost kind of like taking the NCLEX again, which is the boards we take. So I am now certified in OB.
Congratulations.
Give us a little background on you. Where did the interest in medicine start? Where are you from? What got you going? Stuff like that.
So I am born and raised in Rockford. I graduated from East High School. I always knew I wanted to be a nurse and be in the women's and children's area. So I actually went to St. Anthony's Nursing School right out of high school, and I started at Rockford Memorial, and Mother Baby was there for 3 years and then transferred to labor and delivery and have been here for almost 13.
That's outstanding. But you knew from a very young age this is what you wanted to do, and you wanted to be involved in moms and babies.
Yes, I did. It was something I've always been very passionate about, is taking care of women and children.
So you have 2 decades in this field, essentially, right?
Yes, almost.
Congratulations.
I don't know why she sounds like she's 20 years old. Not like this could even be possible.
Cannot believe you're over 25. Right?
Oh, I am. I have 5 kids of my own, so.
Wow.
Oh, not just teaching it, but doing it as well.
You got to bring your work home with you, do you?
Absolutely.
5 kids. That's a lot.
It is.
What are the age ranges on that?
13, and then my youngest are almost 5. They're twins. I heard you saying something about twins. I'm like, yeah, I have twins.
Wow. Wow. So we're guessing, Ashley, you sit down, like once a day?
Maybe.
Okay. Right. Maybe. I'm just tired of hearing what she does, and then you add the family into it. I'm exhausted.
Yeah.
I've heard I'm without kids, but by choice. But I have heard that once you get past 3, it doesn't matter anymore. It's the same workload. Is that true?
You're already outnumbered, so.
Oh, all right.
See, that's why my wife and I talked about that. Do we want to be outnumbered? No. So 2, and then it balances itself out, although we still do feel like we're outnumbered at times.
Yes.
Sometimes you do, yeah, absolutely.
You're working the youth quotient on that one. All right, tell us a little bit about what's unique about the labor, delivery, and mother-baby units at Vaughn Bay.
Yeah, absolutely. So on our labor and delivery unit, we have 10 private labor suites, and those are rooms for moms that come in that are going to have a baby or if they are getting induced. All of these rooms are state-of-the-art, so they are absolutely gorgeous rooms. They all have jetted tubs in them, so moms can use those tubs as a pain option. So if they're having pain and they want to get in the tub, they can use that besides getting, an epidural or pain medication.
Sure.
So that's one of the things that we have. We have plenty of space in these rooms, too. They're absolutely massive. So it makes room for, everybody that needs to be at the delivery, the providers, support people, and if we need any extra personnel in there. So it's awesome. We also, on the unit, have 7 antepartum triage beds. And what I mean by that is those are rooms that we use for patients that come in that, may have high blood pressure or, need to be seen for a little bit. And we would put them in one of those rooms. And those are also private rooms. Those rooms, we also house patients that, are in here for long term that, need to be monitored and cared for during their pregnancy.
Sure.
Other things that we do have, too, is on our unit, we have 2 OR suites, and those suites are used specifically for our procedures we do up in labor and delivery. So our C-sections or any other procedure that we need to do up here. Those are specifically utilized for our unit, and they're just steps away from the labor rooms and also the triage rooms are right on the unit. And that also makes for a very fast delivery if we have to, do something emergently. We also, the one thing that we did add when they were building this was an infant resuscitation room, and that is between the two ORs, and that was specifically designed for this hospital, and it's the only one in the region. And the infant resuscitation room we use for babies that, are born via C-section and need a little bit extra help. The one nice thing about it is for people who have multiples, so meaning twins, triplets, or even quads, because we have done quad deliveries as well here, those babies can go into that room altogether. It can fit up to 3 babies in that room, and it fits everybody from the NICU team that is needed in that room to help resuscitate and stabilize those babies.
You said real quick that the room was designed specifically for Mercy Health here. What was the procedure before you had that special room?
So before that special room, they would just try to stabilize the baby in the OR, so in our operating rooms during the C-section, and now they have a little bit more space outside of the C-section room to be able to do that. So it's been really great for the NICU team to have that space, opposed to having to do it in the C-section room.
Makes perfect sense. Having gone through that with our second child, who, by the way, you mentioned the NICU unit. I have a special place in my heart for them because I have a daughter because of them.
Oh, that's amazing.
We had a real rough go, and thanks to the wonderful people who were there at then Rockford Memorial.
I believe they call.
I cannot say enough good things.
I believe they call them complications, correct?
Yeah.
Yes.
Oh,
okay.
And plenty of them. And plenty of them. And which is why I'm so hyper impressed by your description of how this unit is put together, Ashley. It seems like every thought was gone over 3 or 4 times. You brought in people who have been through every angle of how all of this can go and collected their minds and built this unit.
Yeah, they were really great with asking, people who actually are out taking care of the patients, the nurses, respiratory therapists, the doctors, and helping design the hospital. So it was really great to actually be a part of that.
And when you think about the evolution of how all of this has gone, I can't help it. I always think back to about my own father being born at home in the same bed that his mom was born in, premature at 2 pounds, and they put him in a shoebox in the oven to incubate and keep him warm. He lived to be 85, so it worked. But, the idea, there's a jetted tub, and we've got plenty of room here, and we have really, really advanced as far as this sort of medical science goes.
Yeah, absolutely.
And one more question about the awesome suites you have there. Is that just for scheduled deliveries, or the people that are rushing at the last minute to the hospital? Are they admitted to one of those as well?
Yes, they're admitted to one of those as well, too. It's for anybody that comes in, actively in labor or may think they're in labor or, an induction. It's for everybody that is going to deliver. We use those rooms.
Now, after the baby is delivered, baby stays right there with mom?
Yes. So what we like to do is keep them with mom. We practice the rooming in because studies have shown that babies adjust better outside of the womb when they are kept in the same room with mom. They're learning, their feeding cues, they're smelling the scent of mom. So we really try to keep them with mom.
As somebody that comes into this wildly ignorant of the whole procedure, what was it done beforehand? Did we take the baby away and in the thought of giving mom rest?
Remember the old movies where they're sitting there behind the glass in the nursery?
Yeah.
Yeah.
We don't do that anymore?
I actually worked in the time where we did have a nursery and we would admit the babies in there. So now what we do is we try to keep mom and baby together, and we also practice like the golden hour, which the golden hour is the first hour or two after the baby is born, where they're the most awake and alert, and we try to put them skin to skin with mom. And what that does is that really helps the baby be able to transition from being outside of mom, because mom is the incubator the whole time. They regulate everything for the baby. So putting them skin to skin with mom, that helps the baby be able to transition with their temperature, their heart rate, even their blood sugar. And it also has been shown to improve successful rates with breastfeeding because they're smelling mom and smelling that scent. So we really try to keep them together. We also now do everything in the room with mom and mom, baby, and support person. So like the first bath is done in the room, and we show parents, how to do a bath and help them kind of through that process, especially the first time moms and dads, because they haven't had a baby and maybe they haven't had experience with babies.
As I put it out so many times when it's time to go home, I was serious when I looked at the nurse and said, you're really just going to let us take them home? We have no idea what we're doing, and you're just going to let us go.
It sounds irresponsible.
And that's what I pointed out to her. I said, shouldn't you be looked at for just letting people just walk out of here with a kid like this?
Did you know me in my 20s?
Right.
Oh, yes. So we really try to help educate parents and answer all their questions, and we do a lot of that in the room, help them with diaper changes and, swaddling the baby, and go over, safety practices with what they should do with the baby. All that kind of stuff, just so they are a little bit more comfortable. The other thing, too, that we do provide here is we have classes. So we have a childbirth class that goes over labor and delivery. It also goes over, inductions, C-sections, aftercare, what mom should expect, and it also goes over newborn care. But then we also have dedicated classes for newborns and then also for breastfeeding. And we just started going back in person for these classes, which is amazing. And we also still do have them online. So for anybody that would, it's easier to do it online because they're working and busy and getting ready for a baby, we do offer it on our website so they can watch it on the website.
And it's better for a lot of the guys, too, because you're at home and you're looking at it, and when you faint during the part where the baby is born because you've never seen that before and you're completely freaked out, at least you fall on your own floor.
Well, and I wanted to ask you about that. The cliche dad fainting, is that a Hollywood trope, or is that something that you've seen?
I've seen it.
It does happen, but we just, we're very careful, and we tell them, if you get woozy with needles, or you think you're going to get woozy with a delivery, we'll put a chair behind them so we kind of prevent that from happening. Like, hey, just take a seat, and we'll be right here.
You should put a tumbling mat under them.
See, and she's so kind. With our first one, the anesthesiologist looked at me and goes, hey, you all right with blood and things like that? I said, yeah, I should be fine. He goes, I want you to know, you go face down on this floor. We deal with her first. You're going to lay there. Do you understand? I'm like, yes, sir. I should be okay. He frightened me more than the whole procedure to begin with.
Well, then you did great, right?
I did. Oh, yeah, because he was a pretty large man. I didn't want to make him mad in the middle of all of this. So, I kept it together during all of those things.
You got a gold star for it. Good job.
I think I did.
Yes.
And these suites that are as large as you talk about, Ashley, what's the most amount of family members and support personnel, non-hospital work, that you've seen in a room?
So right now, with COVID going on and everything, we're only allowing 1 to 2 support people in there.
Sure.
But for our rooms, like say we have twins that are going to deliver vaginal, we have enough room in there for the NICU team for, 2 babies and mom and the providers in there. So there's definitely enough room for us to be able to do the care that we need to do in these rooms.
That's outstanding.
Yeah.
Ashley, before we let you go, I know there have to be women and men as well who are listening now who would love to come out and have a look at what you have described for us. Do you do tours?
Yes, we actually do tours. So the easiest way to set up a tour is to call our OB navigator. Her name is Kelly. She is wonderful. She is the main nurse who schedules and also gives the tours. We offer tours to patients, anybody that's thinking that they want to have a baby or isn't sure where they want to deliver. They just would call, Kelly, the OB navigator, or they can call, the 971-5000 and ask for the OB navigator or labor and delivery, and we can help, set that up for them. But we also, we give tours to patients that we go out on transport for because we have a maternal transport team and also a NICU transport team. So we go out and get patients from different surrounding areas because we are the perinatal center. We'll actually give those patients tours in NICU so they can kind of see what to expect. So we give tours to patients that are here. We give tours to people who are going to be delivering here and haven't seen the new facility. And we also give tours to people who are thinking that they're going to have a baby or are newly pregnant and not sure where they want to deliver. And we'll give tours and then kind of talk to them and connect them with providers.
Well, it sounds to me, and I think Joe would agree, that anybody lucky enough to have you around during this unbelievably important and special part of their lives is very, very lucky. And
thank you.
And what you have set up at Vaughn Bay just seems to be world class.
I'm thinking about having a baby just to meet her.
We are the best here. We are the best. We are the regional perinatal center. So, I mean, yes, definitely. Tell everybody to come here.
We will. We will. And you've just done it yourself, too. Ashley Vaughn, we appreciate you taking time out of what we know. Yeah. We're not guessing. We know is a very, very busy schedule.
Yeah, are you at home right now or are you at work?
No, I'm at work.
Oh, okay, I was going to say, it's awfully quiet if you're at home.
Yeah, you had to guess that. With 5 kids and you don't hear anything in the background, she's
you
at
would hear them
work.
screaming if I was at home.
Ashley, thanks so much for your time. We appreciate you and we appreciate what you do.
Oh, thank you so much.
Have a great day. There's Ashley Vaughn from Mercy Health.